Hi everyone, my name is Raja Mikhail and I'm currently postdoc at Yale School of Medicine working on colorectal cancer. And in this video, I would like to talk about symptoms and warning signs related to colorectal cancer in young adults, in individuals under the age of 50 years old. So in my previous videos, I've mentioned that the incidence and mortality rates of colorectal cancer among individuals under the age of 50 years have been alarmingly rising in many developed and developing countries, including the US. In this video, I would like to talk about the symptoms and warning signs related to colorectal cancer in young adults. But before mentioning these symptoms, I would like to let you know that unfortunately, young adults with colorectal cancer are often diagnosed with advanced stage of the disease, so stage 3 and stage 4. Studies shows that young adults with colorectal cancer are diagnosed with advanced stage of the disease 40% compared to their older counterparts, and 67% of these patients had to go and see more than one doctor before they get diagnosed with this malignancy. So regarding the symptoms, the first symptoms and the main one is change in bowel habit. So if you are experiencing with diarrhea or constipations, then you should take these symptoms seriously and you should discuss these symptoms with your GP. And don't assume that these symptoms might be due to the hemorrhoids, for example, because that's what many patients think, and unfortunately they later find out to be diagnosed with colorectal cancer. Now, these symptoms might be related to other less serious diseases, including hemorrhoid or other upper and lower digestive tract diseases. But you should know that having these symptoms is a red flag, and these symptoms should be discussed with your GP, and please don't ignore them. Okay, so the second warning signs regarding to colorectal cancer in young adults is bloody stool. So seeing blood in your stool, that's another red flag, and you should take it very seriously. So please don't assume that this is due to for example, constipation or food or hemorrhoid or any other things. If you see blood in your stool, you should go and see your GP and discuss it with your GP. The third symptoms related to development of colorectal cancer in young adults is being fatigued and exhausted and short of breath. So if you have these symptoms and you feel like you don't want to get up in the morning and you always feel tired and exhausted and sluggish, please again don't wait too long and go and see your GP and discuss these symptoms with your GP. Many people assume that this is probably because of the stress and too much of work, and it might be due to that. But also you should know that anemia and these symptoms, which is usually related to anemia, is one of the symptoms of colorectal cancer. Other signs related to colorectal cancer and symptoms are abdominal pain, so lower abdominal pain and vomitings, as well as lower back pain. These are the symptoms also related to development of colorectal cancer, as well as if you have unexplained weight loss. So all of these symptoms, again, changing bowel habit, seeing blood in your stool, lower back pain, lower abdominal pain, anemia, and being exhausted all the time, and losing weight without any explanations. These are the signals that your body is giving you, and please don't ignore those signals. And don't wait too long and go and see your GP and discuss these symptoms with your GP, because these are the symptoms of colorectal cancer.